3. Assalamualaikum warahmatullahi wabarakatuh. We are group 3 from K4. The title of our presentation is B.T.S of Adrenal Gland Volume 1. So this is our group members and task and responsibility of each members. So let's continue with our discussion. Start with Adrenal.
Okay, first of all, about adrenal gland. Adrenal gland consists of adrenal medulla, which is the inner portion, and adrenal cortex, which is the outer portion. So the adrenal gland cause all type of stress, and its function is to regulate the salt and water balance, secrete a small amount of male and female sex hormones. Next. Now, the adrenal medulla respond in fight or flight reaction by hypothalamus send nerve impulse to many organs through nerve fiber. In this way, it dilates the pupils, speeds the heart, dilates the air passages, inhibits many non-essential bodily functions. So that's all for the introduction. I pass to the next person.
Next slide. So for the next one, we are going to talk about adrenal cortex. Adrenal cortex is the outer region and the largest part in adrenal gland, and it has 3 zones, which is zona glomerulosa, zona fasciculata, and zona reticularis. And each zone has a specific hormone that they produce, and the secondary site of androgen synthesis. Next slide. So you can see here, this is the layer of the adrenal cortex, the 3 layer of adrenal cortex. And for zona glomerulus, they produce aldosterone, which is mineralocorticoid, and zona fasciculata, they produce glomerulosa and reticularis. And the innermost part is zona reticularis, which they produce androgens. So I pass to the next presenter.
So I will explain about glucocorticoids. So what is it actually? They are cholesterol-derived steroid hormones synthesized and secreted by the adrenal gland. So cortisol is the most important glucocorticoid. So one of the function is it promote the breakdown of muscle protein to amino acid, and it will be taken out by the liver from the bloodstream, and then it will be converted into the glucose. And then the next one is mineralocorticoid, which is produced by adrenal cortex. It will regulate salt and water balance, leading to the increase in blood volume and blood pressure. So aldosterone is the most important of mineralocorticoid. So what is actually the role of aldosterone? It will target the kidney, which promotes the renal absorption of sodium and renal excretion of potassium. So some of the comparison of glucocorticoid and mineralocorticoid, which is glucocorticoid, its main important role is about in carbohydrate, lipid, protein, and protein metabolism, while mineralocorticoid, their main function is to actually regulate the plasma sodium and potassium. And then they are not helpful in repairing injury and managing stress like glucocorticoid. Other than that, they also control the electrolyte and water balance of the body. So this is the cycle of regulation of blood pressure and volume. So if we see that when we have low blood in sodium, so kidney will secrete the renal into the blood, and then the cycle will repeated when the kidney reabsorb the sodium and water from the kidney tubule. So it will be repeated with itself. So next presenter is Shafika.
So thank you, Akida. I will explain about the disease and conditions of adrenal cortex. We have Addison disease, and next one is Cushing syndrome. Next. So Addison disease is insufficient secretion of hormones by the adrenal cortex. It's caused by the immune system attack the adrenal cortex. There are few symptoms which are dehydration, weakness, weight loss, hypotension, which is low blood pressure, and increased pigmentation of the skin. the treatment of Addison disease is it involving the replacement of the missing hormones. If Addison disease left untreated, it can be fatal. Next. So about the increased pigmentation of skin, this is the example of the individual who have the increased pigmentation of the skin. Increased pigmentation of the skin is caused by the excessive but ineffective amount of ACTH. ACTH can stimulate the melanocyte to produce melanin. Melanocyte is a cell which in the basal layer of the epidermis. So the next one is Cushing syndrome. It is caused by excessive levels of glucocorticoids, tumors that infect the pituitary gland, and also the administration of glucocorticoids to treat other conditions such as chronic inflammation, which then will result in excess glucocorticoid will cause muscle protein to be metabolized and subcutaneous fat deposited in midsection. Next. So symptoms of excess production of adrenal male sex hormones in women is masculinization, increase in body hair, deepening of voice, and also beard growth. The treatment is careful reduction in the amount of cortisone being taken, use cortisone inhibiting drugs, and also surgery, which is to remove any existing pituitary or adrenal tumor. Next. So this is the example of person with Cushing syndrome. You can see on the left, there are the fat deposition at the abdomen area and also at the back of the neck. And on the right, we compare the face of the normal person with Cushing syndrome person. When they have Cushing syndrome, they have a very big round face and also the cheeks very red. Next. So that is the end. Thank you for listening our presentation. So next, now let's enjoy our interesting interview session. Thank you.
That people not realize is mainly in the Addison disease, because this one is quite a rare disease. It's occur in the 4 in the 100,000 population. So normally is without it's a not acute thing. So it starts slowly, and the symptom normally the patient that will suffer is not realized in the early stage. Okay, in the other term, sometimes the problem is the autoimmune system, or some like chronic infection for the HIV, lupus, tuberculosis, that can cause a complication for the adrenal gland. So that cause this situation that might lead to the normally that cause Addison disease. So it's other problem first that happen. So then the person maybe not realize he will getting this complication because the initial stage is caused by the other problem, or some other in case of tumor. It's not cancerous, it's tumor, it's a slow growing. So after some stage, then it cause problem for the adrenal gland. Yes. These are the like it's one person is born without adrenal gland. Its probability to survive is very low possibility, because Addison disease, patient come with loss of weight, very low blood pressure, then got a skin problem, then sexual underdevelopment, and like fatigue, don't have energy, all those things. So eventually, it's like they come to condition called Addisonian crisis. These are life-threatening. So it's if that person is born without adrenal gland, so that person will don't have the proper hormone to survive. That's the important hormone. Is not beside cortisol. They got the adrenaline, the aldosterone that regulate the blood pressure, regulate the mineral. Then the sexual hormone for the reproduction, the sexual development, and so on and so on. And in my opinion, the person who born without the adrenal gland is eventually won't be survived. The treatment depend on the condition. If the adrenal gland insufficiency, in the Addison disease, for example, you give. So that first we do the diagnosis with the hormone study, or maybe like do the like MRI, the X-ray, the radiological, all those things. So if we find out insufficient, so maybe need a treatment, maybe the person need a medication, something like the steroid, lifelong steroid, like hydrocortisone, for those things. Or some other is problem is like we detect is some other problem, maybe is over secretion hormone. For example, in the Cushing syndrome, Cushing disease. So it's as in the medically we make a diagnosis for those things. We try to find out what the real cause of this thing. For example, if like Cushing syndrome because of drugs, we need to stop the drug that causes this thing, or a tumor. So the patient need to go for the surgery for this thing. Some other is like in the some other like tumor, so maybe cause like for the treatment for pheochromocytoma is some condition for the adrenal gland that cause is a over secretion of the adrenaline that cause very high blood pressure, heart problem, all those things. So in this case, pheochromocytoma may be caused by the tumor, like cancer in the adrenal gland. So that have to remove the tumor to treat for this thing. And some other is an external cause, like the problem with the pituitary gland. It's a tumor, so maybe it can give a disturbance of the hormone for the from pituitary. The ACTH give a problem to adrenal gland. Then normally if a tumor, so then need to treat for the surgery. If need for the drugs, they need to give a medicine drug for this thing. Okay, thank you.